He's been a physical therapist for more than 25 years. Brian Horner's here, owner of Fast Track Physical Therapy. Thanks for being here. Appreciate it.
Appreciate it.
We said during the commercial break we were going to bust some myths about physical therapy,
That's
and
right.
so we're glad to have you here to do exactly that. There is about physical therapy, right? And a lot of it has to do with like doctors and referrals.
True. So October is National Physical Therapy Month, so I thought this would be a great time to come in and talk about the profession of physical therapy, as well as some of these myths or misunderstandings or misconceptions or whatever you want to call it. And so one is, do you need a referral to come see a physical therapist at Fast Track?
Most people assume, got to go get a doctor's
Exactly.
appointment, they have to determine something, then I go to PT.
Exactly. And that was the case just up to a few years ago, like 7, 8 years ago. That was the case. And now you can come see a physical therapist just like you schedule your appointment with your dentist or whatever. So at Fast Track, we typically can get you in within 24, 72 hours or so. And usually, you know, the great thing about doing that is now we can start your care a lot quicker. We can get you on the track to getting better a lot better.
Well, and you don't need a diagnosis from a doctor either.
No, you don't. I mean, and that's another thought is that, well, don't I have to go see my doctor to get a diagnosis first? Or, you know, what happens if I need an MRI or any of those types of things? And so physical therapists are doctors or have their own doctorate degree themselves. And so that's what we went to school for.
Well, and you have other certifications. If I had to list all your certifications, we'd run out of show.
We're musculoskeletal experts. And so when you come in to see us, we're going to evaluate you, diagnose you, and come up with a game plan to get you better.
Okay.
And so that's a great thing is that things have changed with direct access, or meaning you can come see us without a referral, is that we can get you better, and we have the skills to do that. So.
Another misconception is people think you guys are glorified exercise coaches. You're going to stand there while I use a stretchy band, which may be the case, but you, again, going back to you guys being much more than that.
Exactly. So it depends on where you go for your therapy. So that is definitely the case. So I have patients come in all the time that say, well, I went to therapy 2 years ago. All I did is went in there and I was there for 30, 40 minutes, and they made me do a bunch of exercises, and half those exercises are ones that we were already doing at home, and I didn't get any better. And so, at least at Fast Track, how we present and you know, we obviously we're therapists, we believe in exercise, but our therapists are well trained in manual skills or hands-on therapy. We do a lot of dry needling, cupping, using tools to do deep tissue work. We have traction tables if need be with our spine patients. So, you know, so we do a tremendous amount of hands-on work with our patients. So it's not, and we always treat our patients, whether it be the first visit or every visit after, we always treat them for a whole hour.
And the fact that you express this diversity dispels another myth, is that it doesn't matter where you go for PT.
Well, you can go where you want to, but
they may not have this wide.
Exactly. The quality of care and the cost of care aren't always the same for where you go for your therapy. And you know, 60% of our patients that do come to see us have a referral from a physician. But again, if you do have a referral, it's your choice for where you go for your therapy. It's not mandated by the doctor, even though he may suggest going to the hospital therapy where he works at. But you can come to see us, and you're going to get a lot more care and quality of care, and the cost of care is a lot different in a private practice as compared to a hospital setting or a large chain company, because they get reimbursed at a lot higher rate. So if you have a deductible and you haven't met that deductible, you got to pay the entire bill. So your 30 minutes of therapy at the hospital, 40 minutes of therapy at the hospital may cost 2 to 3 times higher than what it would for me, because I can't dictate to the insurance what they're going to pay me. They tell me.
Well, yeah, that's getting in the weeds for some people.
It is.
But
I got you.
These are necessary weeds that you have to get through. And quickly, people think PT is a result of a sports injury or an accident or something along those lines. It's way beyond that.
It is. I mean, we treat all those things. We treat the patient that has had a knee replacement, all that type of stuff. But just like other medical professions, we specialize as well in therapy. So we have therapists that do vertigo or vestibular issues, dizziness, balance disorders. If you got vertigo that's coming from the inner ear, we can usually have that fixed in 2 visits. I mean, hardly ever does it take longer than that. We have myself and another therapist are trained in TMJ or jaw pain or facial pain. We treat a tremendous amount of patients with migraines and chronic headaches. And then, of course, I do custom foot orthotics that are affordable, all those types of things. But yeah, we treat the athletes, the work comp, the person that fell off the ladder, all that. We do all that kind of stuff. Yes.
Fast-tracktherapy.com. We'll put the link on indystyle.tv. Convenient location. I drive by your Speedway location every day, actually twice a day. Avon and more coming.
Avon, and then we have Danville and Mooresville coming.
There you go. Conveniently located, especially for us West Siders, Amber.